Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon, everybody. I will be very quick because we have the prayer time. So I'm going to speak about the scars as from the plastic surgical point of view. So a scar is something always we related to an evil things. So especially if it is on the face. So most of the patients, they come to us because they want to have some changes or improvement to avoid the evil look. So actually a scar develops because of developing of fibrotic tissue and damage of the skin. And it could be because of elongated of inflammation process, which may convert to an infection. It could be surgical injuries, trauma, anything. So we have so many risk factors. We have the wound infection, we have trauma, we have multiple reoperations, we have poor surgical techniques, we have poor wound management, we have the age of the patient, we have skin color, we have genetics, and the depth of the incision. So it's very important to control all these things. So we have different type of scars. First, we have the keloid scars. Everybody knows about it. And we have the hypertrophic scars. All these are my patients or our patients in the hospital. And we have the contractures, which is developed and causing different type of deformities on different part of the bodies. And we have the adhesions of the scars to different part of the body. So tips to reduce the appearance of the scar. First of all, it's very important that once you have a scar or you have an injury to the wound, you have to make sure that the wound is clean. So it's recommended that you will not use something which irritates the skin. You will not use betadine or chlorhexidine because all these will create irritation. You may use around the wound, around the injury to create a clean, let us say, sterile environment. But inside the wound, it's recommended that you use something gentle, like hyperoxidized water. We have different type of companies, and I'm sorry I cannot mention any names because I'm not from the companies. And then, of course, you have to use a moisturizer, different type of moisturizers. If you don't see any let us say, inflammation in the area, you will use just a normal moisturizer. But if you see any signs of redness, of course, you have to use something with cortisone, like Fusidine Edge, Fusicort, or anything else, because you need to reduce the timing of the inflammation. If you have long timing of inflammation, you have an ugly scar. And of course, there are different types of moisturizers. We have the petroleum products and we have non-petroleum products. On the bodies, you can use the petroleum products, which cause very nice moisturizing effect, but on the face, you cannot use that. You have to use non-petroleum products. And then you have to cover the area because you cannot leave it open for the normal flora or for the dust or for the sun, and this will cause an ugly scar formation. And then change the bandage. Some people, they say daily, and others, they say you have to keep it for a while. There are different studies about that, but it depends on the scar. If the injury, let's say it's clean and you are not expecting that it will convert to an infection, it's better to cover it with something, with silver, with silicone or something like that, and keep it closed for a longer period. But if you are expecting that it may convert to infection, it's better to reopen more often. And stitches, it's very important how you put the stitches. From our point of view as a surgeon, it's very important that once you have an injury, it's very important that you keep all the layers next to each other. It's not just to close the wound. The idea is not just closing. The idea is to approximate the layers together, and then you will use stitches which are very gentle to the body. For example, if you use Vicryl, it may cause granuloma, irritation, and pus formation after a while. So if you want to use the Vicryl, you have to use it deep inside the tissue, not outside. More to the superficial, we use monofilaments because they are more gentle to the skin. And of course, we approximate all the layers and we stitch subcuticular, so we don't put any stitches outside except if you feel that there will be any tension. And of course, the sunscreen. Sunscreen is very important, but there are so many argues about what the SPF you will use. Some people, they say 30, others, they say 50. The companies, they will say 100 or total block. From my point of view as a surgeon, and I have a little bit dermatological experience, I would say 30 to 50 is more than enough. More than the 50, you are using more chemicals, but you will not have a big difference. So treatment options direct after scar formation. You have some people, they use silicone gel, other people, they use silicone sheet or polyurethane sheet. These are good, but the thing is you have to make sure that the scar itself, it's healed. It's still not open, because if it is open, you may cause infection, especially if you use the sheet. But once the wound is healed, or let us say superficially waterproof, usually within 4 days it's a waterproof. So we ask the patient to take shower, do whatever they want. They don't need to cover any dressing on top of it. Then they can use the silicone sheet or polyurethane sheet. And the difference between the gel and the sheet is, the idea is that we did a study to compare these two together. We found that the idea is that you need to approximate the edges of the scar itself, so there will be no tension, no elevation, because the scar tried to pull it laterally and then push it upwards. So with the gel, you cannot prevent that, but with the sheet, you will be able to prevent the pulling sidewise and pushing upwards. So the result with the sheet will be better if the scar is healed. And we have other treatment options. We have dermabrasion, we have chemical peels. I will not speak about all these things because we don't have time. We have collagen injection, we have cortisone injection, we have cryosurgery, we have laser resurfacing. We have so many laser machines which we are using for the scars. We have CO2 laser, erbium YAG laser, diode laser, pulse dye laser. And then we have the punch graft, and we have the surgical scar revision, and in the end, we have the radiation therapy. Thank you very much.